So we have a terrific panel that we're gonna spend a little time talking about this with, and I will introduce them each briefly. So to my immediate left is Harry Lawson Jr. He's the director of the National Education Association Human and Civil Rights Department, where he manages leadership and professional development programs and other programs in support of social and racial justice. He's been there for about 13 years. And he went over to NEA from the National Income Housing Coalition, where he was a field director working on creating the National Housing Trust Fund. To his left, we have Nan Roman, who is president and CEO of the National Alliance to End Homelessness. She is the country's leading voice on solutions to end homelessness. She has researched and written on the issues of homelessness for decades. And she has really been a pioneer, I think, in this work of seeing the intersections of housing with so many other sectors and building those relationships. To her left is Rich Hooks Wayman, who is the National Executive Director of the Children's Defense Fund. And he leads the organization's advocacy, policy program, and organizing efforts to end child poverty, to ensure access to quality, affordable, and mental health coverage, expand opportunities for childcare for low-income families, and promote educational equity and improve the well-being of children. To his left is Peggy Bailey. And Peggy, some of you met earlier this weekend at the State Coalition Partners meeting. She's the director of the Health Integration Project at the Center on Budget and Policy Priorities, where she oversees its work to identify opportunities to improve healthcare policy by better linking it with housing programs, by serving those involved in the criminal justice system, improving quality and access to behavioral health services, and incorporating human services needed by vulnerable populations. And our final panelist today is Margaret diZerega. Did I say that correctly? Okay. She's project director of sentencing and corrections at the Vera Institute, and she works with corrections departments, juvenile justice agencies, and faith and community-based organizations to support them in adopting family-focused and strength-based approaches. So really tremendous panel, and I think it'll be an interesting conversation. So to start, I just want to ask each of you, and maybe Harry, we can start and move down the line, to talk a little bit about your organization, the focus of the work of your organization, and how you came to start to see housing as a central solution to achieving your mission.
Thank you. Thank you. And this is actually very nice. It's a homecoming. I used to be here every year at one time or another. See some familiar faces. Yeah. I think so. For those of you who don't know, the National Education Association is the country's largest public employee union. We represent classroom practitioners, as well as a variety of adults who work in the school building. So we call them support professionals, right? So paras, food service workers, bus drivers, all across this country, as well as higher ed faculty. And so we, I think those of you who are familiar with us, I mean, we have good rhetoric around whole child support. And I think ultimately what we've been trying to do, particularly the last couple of years, is actually actualize that rhetoric in terms of not just talking about what we do in the classroom and in school buildings, but how do we become effective advocates for young people in the communities that they live in a more substantial way. So we have a long history in terms of some of our social justice work, particularly in the 60s and 70s, and actually present as well, but I don't know that we do a good job of partnering. We, as a union, we tend to be very isolated and insular, and we're trying, I think the conditions of today, as many of you probably know or are clear about, is calling for us and providing an opportunity for us to really sort of broaden who we talk to, what we talk about, and who we work with. And so a lot of our work in the Human and Civil Rights Department, essentially, to be candid, is to put the human back in the human and civil rights as it relates to public education. Some of our friends, I think, even from the Children's Defense Fund in the past, I mean, some of the work that we've done, and I would imagine Margaret from Vera in terms of our school discipline work or the lack thereof. So just across the board, we are, out of the Human and Civil Rights Department, really trying to make a change in terms of some of the work that we do with educators on behalf of students, and to really sort of, again, actualize the rhetoric that we use in terms of our support for young people.
Then we work pretty much only at the federal level, because we're small, unlike NEA, to get federal policy and resources that can support those solutions. And then we work at the local level with do some capacity building at the local level and provide tools and so forth to help people implement those solutions at the local level. The reason we're interested in housing is because housing or lack thereof is what drives homelessness. People who are housed aren't homeless. So that's the solution. We're kind of the crisis system that helps people who lose their housing get back into housing. We have been proud supporters and partners with the National Low-Income Housing Coalition for a long time because we need the National Low-Income Housing Coalition to succeed in its goal so that we don't have to deal with homelessness anymore. But I will say that the homeless system, I think sometimes we forget how much housing the homeless system itself is generating. It's created about 350,000, maybe even more, about 350,000 units of permanent supportive housing and hundreds of thousands of shorter-term housing opportunities through rapid rehousing, shorter-term subsidies, because we can't get enough of those longer-term subsidies. So the homeless system itself has actually, I think, been generating a lot of incremental housing. In fact, I think the VA, the HUD-VASH program, which supports veterans with permanent supportive housing, has been the only incremental increases in Section 8 that we've gotten in quite a long time. So while we're trying to support the work that other housing organizations are doing, we're also generating some housing of our own in the homeless system.
Hello. The Children's Defense Fund, as some of you may know, is an independent voice for children in America. We've been around since 1973, and we take an approach towards the whole child. We do not believe that children come in pieces. We believe that you have to advocate for all sectors of child's life, including education, well-being, health, poverty, and all the investments that need to go into positive child development. My founder and president, Miriam Wright Edelman, will tell you that in 1973, when they were founding the Children's Defense Fund, they saw two pathways to ending child poverty and improving the outcomes of child well-being. One was improving access to health care, and one was ending homelessness and expanding affordable housing for low-income children. But as a small organization in 1973, they didn't have the bandwidth to do both, and so they chose health care as their emphasis. And for the last 40 years, I think the Children's Defense Fund has been having an emphasis on advocating for opportunities to access health care for all children in America. Of course, we've also been a strong voice for other systems change work in child poverty, child welfare, juvenile justice, and early child care and educational issues. But I think our wake-up call in regards to affordable housing and homelessness came in 2015 when we commissioned a research study with the Urban Institute and to try to look at what federal policies needed to be invested in to end child poverty in our lifetime. And in that study, we found that the number one benefit that could be done to end child poverty was actually increase affordable housing, to increase the supply of subsidized. So that was our report in 2015 called Ending Child Poverty, and it's on our website if you care to look at it. But from that point, I think in 2015, the Children's Defense Fund, our president and our board began to emphasize housing and ending of child homelessness as a pathway that we should become more involved in. And so we're very happy to be here today, and I'm so glad that we're having this dialogue.
And hi, so my name is Peggy Bailey, and I'm with the Center on Budget and Policy Priorities. We are a DC-based think tank that is often quoted as being left-leaning, but I really firmly believe that that is only because our mission is to protect the social service safety net, and that actually should not be left-leaning. That should be what we're all here about. So. You heard from Barbara Sard earlier today, so I'm going to talk from the healthcare side because with my job at the center, I sit between both the health and the housing teams, in our Connecting the Dots project. My job is literally to connect the dots between our housing team, our healthcare team, our human services teams, to make sure that policy is informing each other and that we're involved in all aspects of the work. And from the healthcare standpoint, it was really interesting. You know, Barbara Sard and on the healthcare team, our vice president is Judy Solomon. They've worked together for decades, both in New England. They knew each other. They've known each other at the center for a long time, but they hadn't actually had a work-related conversation until they started thinking through this project. And I think what symbolizes what we needed, why this is important to talk across even just our teams internally, was one conversation about, you know, it's become really popular to talk from a healthcare standpoint about how the healthcare system needs to pay for housing. When you say that to the healthcare folks, particularly Medicaid folks, they're like, no, and they turn around and they leave. And what this project has forced us to do, and Judy said, well, wait, I realize by just saying no, I'm ending the conversation. There's no place to move if I just say no. I need to explain why I'm saying no, and then think through, well, what exactly am I saying no to? Maybe there's some room here. Let's talk about it. And that's what I think what we see at the center, is this opportunity to really talk to each other from different systems and think through real solutions, because as Rich said, we're talking about whole people. One of my favorite people in Los Angeles, Mitch Katz, always says, people come to us as a person and it's us that splits them apart. Yeah. And that's wrong. We need to treat people as whole people, and that's what we hope to do at the center.
Hi, I'm Margaret diZerega from the Vera Institute of Justice. For those of you who don't know us, we've been around since 1961, doing various aspects of criminal justice reform around the country. And the way that Vera operates is we work in partnership with government agencies. So oftentimes we'll partner with a corrections agency, a jail, a sentencing commission, depending on the jurisdiction. And you know, it was great to hear throughout the day various people up here talking about criminal justice issues and the housing crisis facing people coming out of jail or prison or juvenile facilities. So, you know, the way that we got into working with and public housing authorities have been sort of a newer partner to us over the last 5 years or so. But the way we've gotten into that is really, you know, thinking about the shared values we have around public safety and opportunities for people who have been involved in the criminal justice system and for their families. And we're often in a position where we can bring different aspects of government agencies together to talk about their shared challenges, ways they can work together. And so working with public housing authorities on how they can expand access for people who have a conviction history, thinking about ways public housing authorities can help people come home to live with their families who are already public housing residents, is something that I've gotten the chance to work on the last few years. And it's really great to be here with you all. You know, my first real job was actually at LIHC. I started as like the newsletter intern for the Community Safety Initiative. So it's fun when I get to come back and be in a room of people focused on housing. It's like full circle.
Great, thank you all. So, so coming back to maybe the name of your project, Peggy, Connecting the Dots, because I think that's really aptly named, and especially for this conversation. And it seems that one of the biggest challenges maybe we have in talking to each other from different sectors is the fact that we talk about housing differently. And I think you know, we find that people maybe in the health sector, the education sector, find housing to be really complicated and probably unnecessarily so. We probably create a lot of that ourselves because as housers we can get pretty weedy and wonky pretty quickly. So talk a little bit about what you've learned in your experiences and how you kind of bridge that divide and talk about housing differently.
Well, it's a continual process, right? So it's interesting because you know, I got my start working on these things at the National Alliance on Homelessness probably about almost exactly 14 years ago, I think, this week. When I started there, I was the youth policy analyst, you know, and I had come with a public health background and working on Medicaid for children for the Association of Maternal and Child Health Programs. But I started out in youth housing because the Alliance was looking for someone who knew both housing and health, and that was a hard person to find, luckily for me, because a year later, after being at the Alliance for a while, I knew enough about housing and knew the healthcare part, and so that's when I first started working on the health and housing piece, and it's still a continual process, especially now being at the center, where precision on language around housing is valued, and I'm not always as precise as I should be. So I feel all of the first piece is to be gentle with your healthcare colleagues, because our language may not be as precise as you would want it to be. We might talk about housing in glowing terms because we think we want what you have, and you may not have that same optimism about housing being available and the struggle that you have working in the housing system every day. It's important not to reflect that back onto the healthcare system when we're trying to partner. I think one of the things that I see that I feel is either the pragmatism or the pessimism about how sometimes we feel about affordable housing resources and the fact that there's never enough, and that being the prevailing message sometimes gets us as housers disinvited from meetings, because people are like, okay, well, I'm not going to go talk to the housing person because they're just going to tell me how there's no affordable housing. And that is to our detriment. So I think we really need to think about not what we don't have, but what could we have, and what do we have to bring to the table. We're studying right now states and localities that have created their own rental assistance programs from the healthcare side of the world, because I think the healthcare side of the world has tried to solve the housing problem a little bit, and what we're seeing is that they're not engaging the housing system when they're doing that, and it's creating a lot of problems. So we want to look at those, study those, and try to put some best practices out there for folks so that we can so that we can partner across and help the healthcare system solve their problem, solve the housing problems. What I think we need to focus on is that bringing the solutions and talking about our goals and realizing that we have things to bring to the table, even if we don't have that unit to bring to the table. One of the things that surprises the healthcare system about housing is how many services we as housers provide to people in affordable housing. I've had meetings with managed care and talk about supportive housing in particular, but even affordable housing and what happens in an affordable housing space. And they are shocked. They're like, well, why are you doing all that? You should be coming to us about that. If 70% of your building is under United Healthcare, we will gladly come and provide services or figure out ways to pay for the services. The other thing is breaking down our silos in the housing system. I think Clinton maybe mentioned this a little bit on the previous panel, but really thinking about how we can work together as housers would make it so much easier for other systems to work with us. And the last piece is really thinking about recognizing within the systems how that we need to advocate for our partners, and thinking about not only what can they give to us, but what could we provide to them. The healthcare system doesn't know that only 1 in 4 eligible families for affordable housing get affordable housing. They think about housing, they think about things as entitlements. If you're eligible, you get it. So being able to educate them on that so they can advocate for us, but then that means we need to step up to the table in times like these with the Affordable Care Act pieces being under threat, to step up and advocate with them too, so that we can be seen as partners together.
Thanks. And Margaret, what's your perspective in the conversations you've had with the criminal justice world and correctional workers? How have you talked about housing and what's resonated?
Sure. So I think, for people who are running jails and prisons, they need people to leave those places and go out into the community. And so they're very interested in housing. And I think what they are not always as skilled at is sort of having some of that bridge building conversation with community organizations, with affordable housing developers, public housing authorities, to talk about their kind of shared goals. Just in preparing for today, I was reflecting on some of the conversations I've had with housing authorities in the last few years about whether they're interested in revising their policies around admissions for people who may have had a conviction in the past, or who may want to develop a reentry program. And so I tell them about the partnership we have with the New York City Housing Authority and the Housing Authority of New Orleans, and we've worked with them on these issues. And it's interesting to see what brings those housing authorities to call us. So initially, I think it was some of the guidance from HUD, the letter from Secretary Donovan, encouraging housing authorities to use their discretion and really give people a second chance, and the sort of sustained leadership we saw at HUD the last few years on this topic. And then, I recently got a call from a place in Pennsylvania that said, okay, we have figured out how to work with the police. We have, quote unquote, cleaned out our developments, and they're very safe. So now we can think about letting some people back. So that was kind of interesting. And we see that with prison reform too, that if you don't have kind of the general basics of safety and security working in a prison, it's going to be really hard to talk about kind of that next level of how can we really engage families and involve them in case management and increase visiting and things like that. And then I had a different conversation with the Housing Authority in New York, saying that they felt like their policies are now out of date, and they have very strict rules, barring people with felony convictions effectively for life. They're adamant about one strike, and they're like, we need to catch up. Our residents are asking for this, and it's time for us to do something. So it's just interesting how what's bringing housing authorities into the conversation. And I think that, through the work that Vera does in a number of jurisdictions around the country, we can also help with some of that bridge building from the criminal justice actors to the housing authority, where maybe, the criminal justice folks felt like the housing authority isn't even an option, and they may not know about the policies, or maybe policies have changed, or there's a willingness to change. And so, so that's some of the work that we want to do. And then I think the other piece is, particularly in New Orleans and New York City, where we've gotten to work with housing authorities very closely, we've heard from residents and from property managers and others that about the very real public safety concerns that they have, which is very understandable and important to keep at the forefront of these discussions. And so also, bringing to bear the research about, what helps reduce people's risk of recidivism, risk of violence, things like that, and bringing what we know from the criminal justice research to inform some of these conversations, and trying to encourage, we don't need housing authorities to retry somebody's case, right? That's not a great plan. But instead, let the housing authority do what they do best, let parole or probation do what they do, and hopefully by sort of sharing the perceived risk of increasing access to housing for people who have been incarcerated or have a conviction history, both sides can sort of be more comfortable and kind of move forward together.
Great, thanks. So another thread maybe that I've heard here a couple times is how we tend to, as housers, maybe go to other sectors and say, this is how we need you to help us achieve what we want, and this is what we need from you. And so, Nan, maybe you can start talking by talking a little bit about how we can approach those conversations a little differently, so that it's a little more, recognizing the interconnectedness of these issues, and in a way that makes the relationships and the work more mutually beneficial.
Sure, and I might switch a little bit from the partnerships to the advocacy also, because I think just was thinking, listening to you, that there's a little bit different between trying to get partners. They're obviously linked at the local level to work together versus trying to get other sectors to help us advocate for housing at the national level. And I will say one thing, from my perspective anyway, on the homelessness side, there's been a big increase in the local awareness, I would say, of the homelessness issue and the lack of affordable housing and the impact it's having on other sectors. This I think has emerged in maybe the past 18 months. That I think you know, it's, as long as I've been in housing, I think we've said, you know, well, we have to get all these other sectors to help us get housing. It's just a matter of explaining it to them in a really smart way, and they'll get it, and then they'll, but we've never succeeded in that. But now it seems like there is much more of an opportunity, so we shouldn't blow it. And the second thing is going back to Cushing's quote, which is 100% true. We're obviously not doing a good idea of explaining housing as housers, or we would have a lot more housing resources. So there's something about what we're doing that's not working. And I think one of the things is that we devolve into discussing housing finance. That's how we start describing it. You could see it in some of the presentations here today. Even you know, I'm not a houser, but I feel like I've been in the housing field for a really long time, and I get lost in these conversations. You know, it's not about the housing finance, it's about something else. And so that brings me to the next thing, which is I think we need to listen to how other people talk about housing. For example, I was at the NEA with some of your policy people, and they were explaining to me what they're interested in, why they were interested in working on housing with us. And it had to do with two things. Moving around schools, the kids not being able to stay in a single school, and where are the teachers going to live. Housing was not a word that came up actually in that discussion, but those were the two things they were worried about. We were working with some people on the health side. They said, I don't really care. This was this Academy of Pediatricians. I don't really care if people are housed. That's not our particular interest. It's they need safe housing and healthy housing. You know, the asthma. Dr. Carson raised it today. All these things that we see. In one way, he didn't really talk very much about housing. He talked about all the things. I'm trying to be positive here. We're looking on the bright side. He talked about all the things that housing does. Right? So we need to listen to how other people talk about housing and talk about housing that way. Because when we talk about housing, we lose everybody immediately because it devolves right into the, you know, is it a 4% credit or a 9% credit? I don't even know what's the difference between a 4% credit and 9%. So anyway, I may just be showing my own ignorance, but I get the asthma a lot better than the 4 and 9% credits myself.
Yeah. So, okay, so we talked a bit about a lot of good insights on the language and how we kind of approach some of these relationships. So let's talk about a little bit about how it can actually work. And Harry, maybe you can start by talking about, you know, what will bring teachers at the local level, at the state level, at the national level to be involved in both the local decisions about how the housing is created and where it's created, but also this idea of getting involved in advocacy for more resources for affordable housing.
I think what we're learning is to focus in on the students, right? To get the conversation really focused around the young people in the school. So what is best for students? So when I introduced myself, I talked a lot about this idea of actualizing the rhetoric. So, and I said that because typically, if you talk to classroom teachers, paras, anybody who works in the school, they talk about their children, our children, how much they love the children. But when we start to talk to them about the interconnectedness of housing and education, their eyes glaze over how important housing is into the discussion about where schools are placed, right? Who goes to what school? Again, there's sort of a glaze. But when we talk to them about the importance of where their children live, right? What they are dealing with on a day-to-day basis, what the impacts on the young people are prior to them coming to school, those kinds of things, the conversation shifts. So at one point, what Diane's referring to, at one point we made an effort to try to connect, so back up a little. So for those of you not familiar with our structure, we are national, we have state affiliates, and we have local affiliates. We say that we have a member in every congressional district in the country. Whether we can actually mobilize them is still yet to be seen. We're working on that. But because of that, we've got a great reach, right? And typically wherever there is a school, there is a community that surrounds that school. Oftentimes, a lot of the schools that we are focused on, a lot of the educators that we are focused on are working in what we refer to as high-need schools. And typically, they are either in the middle of, right, housing developments or very close to housing developments. So to not be talking to the housing folks at all, or the folks who are providing services as a result of proximity to housing is a problem, right? Particularly as we are moving back into this conversation around community schools, and so providing services within the school building, things like that. If we're not connecting those discussions and connecting those people, it's a problem. So we tried a few years ago to connect some of our state affiliates and a few targeted locals to the choice program discussions. The short answer would be it was a fail, because again, just not being able to make the connection, but we've had some folks come back to us. The more that we've talked about, the more that we've changed the conversation to focus on the young people, we've had some folks come back to us to ask us who they should be reaching out to, who should we talk to. But I think at the core, listening to the folks up on the panel, we have the same problem. And the big problem is that typically the folks in education, at least my experience in the last 13 years, they don't want to be involved in a conversation where they're not the expert. On education and classroom practices, on pedagogy, right, we are the experts. On housing, what the impact of low-income and affordable housing is on young people, we are not the experts. And there's this disconnect, which we are trying to work on at the national, state, and local level, is that you don't actually have to be the expert. There are people doing this work who we can take advantage of their expertise to partner and do some good work on behalf of the very young people that you say you care about. And that is, I mean, essentially that's how we've tried to frame it. That seems to work for classroom practice, particularly the classroom practitioners. But the results are sort of in front of us. And the only thing I would add is that I think our job right now at the national level is to connect the dots better, to identify the language that we can all use to connect people. But more importantly, we think the opportunity for local connection, because from the education world, at least in our world, we don't think we're going to have much success at the federal level, at least for the next 4 years. Anybody who thinks that we're going to be passing good ed policy over the next few years, I think is kidding themselves. And in many cases at the state level, we're going to have some challenges given what state legislatures and the governors look like. But where we can win, where we can really fight and win, is at the local level. And so getting people connected in support of young people and the communities that they're in, that's where we're trying to focus a lot of our attention, and just connecting the dots for people so that they can actually broaden the movement around supporting young people is how we're trying to frame everything that we do, at least in the coming years. And we think that we've got some traction. But again, the housing, I've been at NEA for 13 years after leaving the coalition, and this is the first time I've been here, right? So just to put it in context, so just to be honest and candid about it, right? I've been there for 13 years talking about housing. People kind of look at me funny, even though we've weighed in on a lot of diZerega cases, right? Where just the one in Louisville just recently, right? You had a bill die in Kentucky, right? But actually making that connection for folks and why it's important for us to talk to the housers per se, we still have a ways to go. And so I think some of what I've heard here will be helpful, but what I hope is that what you heard from me is focusing the discussion on the young people it actually resonates with educators a little bit different than even attempting to talk about the policy itself. And just one nugget to give you an example. How many people are familiar with ESSA? The reauthorization of the Elementary and Secondary Education Act is now referred to as Every Student Succeeds, formerly known as No Child Left Behind. So for all the impacts that it will have on educators, our messaging tells us that we can't use that phrase because our own members don't know what ESSA is. And the reason I'm bringing that up is because it's policy. But as long as we talk about the opportunities that they have in that policy to affect change for the students that they serve, then they will respond to that. But they will not respond to messages about ESSA. They don't respond to anything that has ESSA on it. They tell us that they don't know what it is. And so I hope as we respond directly to the question, I think as long as we're talking about young people, what the impacts are, we have a chance to get people connected.
That's great, thank you. Rich, what are your thoughts about how do we actually make this work? How do we engage the other sectors in a way that we're actually working together at a local level, but nationally that we're advancing policy solutions for affordable housing?
So I come at this, we've been talking a lot at the Children's Defense Fund from a framework of movements, right? So that we believe that movements don't start with the national groups. It actually happens at the lowest levels of community and builds up, right, to create change. But the difficulty with movements is that over time there can be a lot of movement and they may have no impact on policy, either on appropriations or on good public policy. And so the question is, if you're building a time of movement, and I really believe we're in a time of movement. I believe that we're at a very troubling cultural impasse around divides in our nation. And there are movements on both sides, right? There are movements on both sides. We saw a movement to elect President Trump, whether you support that or not. And on the other side, you see movements to counteract the new administration. But people are engaged, are alive in a way that we haven't seen for several decades, I believe. I just had a friend the other day post a picture on Facebook, and it was a picture of her 72-year-old grandmother holding a sign over a freeway overpass. The grandmother had never protested in her life, and here she is outside with a sign over a freeway, right? So if that's the level we're at, if people are showing up for the first time on either side of the spectrum, I think the question is, how do we mobilize that to effectuate good policy? And for me, I think about that in two general ways. I think about that movements turn into good public policy when you have outlays of communication. So you're having communication going out that feeds solutions to people, right? Grounded solutions and best practices are what we know works, or the fact that we think we know there are positive returns on investment, or whatever you want to frame it as. There are communication outlays. And then there's operational capacity to turn the movement into policy advocacy. And that's really about organizing and staffing, right? So it's a marriage of both of those. So at the Children's Defense Fund, we're taking some time right now to think about that as child advocates, if we really do say where our mission is to end child poverty and to make sure that all children have a fair and equal start to life and access to equal opportunities, how do we take this period of movement and really build on that? In regards to communication, I think what we see is the fact that we should take some lessons from the playbook that we've seen successful the last 30 years, in the sense that on the right, I believe that they have been very effective in keeping repetitive, simple communication that has been selling. Does that make sense? And on the left, frankly, there's a diffusion of messaging. Does that make sense? Everybody's talking in different angles, and there's no commonality in some ways. I think if we're going to be effective on the communication standpoint, we have to figure out what is that simple, repetitive message that we're pushing out among multiple partners. And I think in that way, that's hard because we all come at this from different priorities, frankly, still to this day, and that's why we have some difficulty partnering. But to the extent that we can start to come together on some messaging, I think is important. And I think for the national groups, I think that's also talking about our own little territories of what we call our lists. So we each keep our lists of stakeholders, right? Our email list, our contact list, and are willing to share that with each other, frankly, right? So if I'm a 20 million union, a $3 million person, whatever, 200,000, whatever our list is, I think the question is, how are we going to open our list to each other so that if I share my communication, if I'm going to accept your communication point, am I willing to push that out through my communication standpoint? And how do I do that in a way that's good framing? But beyond communication, I think the point I really want to make today is that I really believe it's more than communication. It's really about direct action, nonviolent direct action. I think people really want to be involved in some ways. And I think what we haven't been good about is giving people a creative way to be involved. One is, I think we're limited in our nonprofit capacity sometimes to round up the volunteers that actually want to come to us to be engaged. Does that make sense? We don't know what to do with them, and what we tell them is, call your representative, call your senator, do this email vote, sign up for something. And some people are not comfortable doing that, right? They want to do other things. They want to be organized. They want to be in a community. They want to show up in their local communities. And we haven't figured out a way to bring those people together in a movement that organizes them to do direct action in creative ways, right? So movements are partly about theater. And I think we've forgotten some of that. I'll admit, I'm somewhat near the DC area, and I'm an outsider, but on the local level, people engage in theater to make their points, right? Protests, rallies, social media, but theater sometimes carries messages and it sometimes changes mind, and I think we have to think about creative ways that people can engage in the theater of protest, and also trying to figure out how we can engage them in a sense of community together doing action. So from the Children's Defense Fund, I'll be honest, our playbook right now, if you ask me, is that we're really focused on the next generation of leaders. So we really believe that we have to focus on the X generation and the millennials and the people before the millennials and try to give them opportunities to be engaged in direct action. So we're doing a lot of campus organizing in the next couple of years. Campus organizing, community organizing, and national organizing with staff on the ground. That's what we see as our playbook because we think that that helps us propel our message. So to the extent that I can find the crisscross between child poverty, child well-being, and housing, it has to do with the fact that I have to engage people in the movement by doing smart communication and having opportunities to be engaged.
That's great, thank you. So I'm going to ask one more question, and then we'll open it up for questions from the audience. But so I think the fact that we are all coming together in the way we are and starting to plan and think through how we can work together more deliberately to create this kind of advocacy movement at the national level is really important and really good. And I think we will be successful if that's being replicated at the state level and at the local level, right? Similar kind of connections and interactions and relationships being built and broadened. And in some places that's already happening. I mean, California has really been leading the way on this type of interconnected, multi-sector engagement. Massachusetts has done a lot of work on this. There are many states that have already begun or are way ahead in this. But for just any advice that we have that to give to people who would like to take this idea and this work back to their local communities, to start thinking about ways to break down some of the silos and to talk with some of the other sectors in this kind of intentional way.
Yeah, well, I can start. I think one of the things, and you all are doing this already, but it is the putting a face and being able to tell a story very specifically. I mean, we've been able to see that with the Affordable Care Act protection of it. The fact that I get to talk about what the Affordable Care Act did for people with substance use disorders is fantastic. I mean, for years we've always talked about, oh, we can't talk about them because they're not a sympathetic population. But, I don't have time to get into why now they are a sympathetic population, but I'm just gonna jump on the bandwagon and be thankful that they are and use that and tell that story. So the New York Times did a story in February and talked to a person that said, I am taking one of the treatment medications for heroin. If I don't have my health insurance, I can't pay for this insurance, for this medication, and I will likely become addicted again because I won't be able to be stable. Being able to tell that story from an affordable housing standpoint is just as powerful. Being able to tell the story of the family that needs their voucher in order to stay housed. And talking about it from a positive standpoint. We just kicked off a blog series about how vouchers work. We did the same thing for Medicaid. Medicaid works to try to combat this message that government programs and social programs don't work, that they go to undeserving people, trying to, that all the bad things that we hear. It's like, no, actually, vouchers are an extraordinarily efficient way to solve the affordable housing crisis, and we're gonna show you how, and that's what we're doing through our voucher series. So being able to talk about the positive stories and the impact, and then showing what then the lack of that would do is really important.
Great. Others? Dan, you want to add?
I would say that homelessness is a place to start at the local level, because homelessness is the extreme housing problem. It's the extreme that proves the rule that there isn't enough housing. And the homeless sector tends to be pretty partnered up with a lot of other groups. So it's involved with veterans. It's generally, depends on the community, but generally works with law enforcement and correction systems. It's involved with behavioral health. It's usually involved with TANF and different kinds of family systems. It's generally involved with the faith community or comes out of the faith community. That's, I think, going to be an important community for us. Philanthropy is very key to the homeless system. So it's, maybe a little bit more than most of the housing systems, a little bit more integrated with the others. And so I think that might be a place for communities to start building housing coalitions around all of these different sectors. An opportunity, anyway.
Harry?
Yeah, I think what we are seeing, we are starting to see some real activist locals. So Seattle, Milwaukee, in the AFT world, Philly has been great in terms of some of the work they've done around creating Black Lives Matter curriculum and advocating on behalf of their students. So I think there's some opportunities. So I think it really is just connecting, actually making the outreach to be, based on my experience in working at NEA and being in the field, and for the first 9 years that I was there, I worked in the field, worked in 42 states, countless cities doing organizing for NEA. And I think it was Nan that said it. I mean, we haven't been good in terms of responding to the community as educators. I think we're starting to see some folks do better. And if we can get out of our own way, I think, so even though it didn't work 10 years ago, let's try it again. And I think what we'll find is that there are a lot of educators who are looking to be a part of the movement locally on behalf of because of what they see, because of the stories that they are hearing, not just directly from their students, but just coming up out of the community that they're working in. So I think I hope I didn't make it seem like there was no way earlier, but I think we are seeing it ourselves, that we have locals and a couple of state affiliates, in fact, that are way ahead of us in terms of the equity work that they're doing. And it really is just a matter, I think, of folks making the connections and avoiding the wonky talk. We tell our members to do the same thing, because trying to have a conversation with somebody about ed policy it's a snoozer, right? And I think that happens too when I've tried to talk to people about housing. When I first got to NEA, people looked at me and sort of, would shake their heads. So I just think that there really are opportunities all over the country with locals looking to join the movement, so to speak.
Great, thank you. So questions from the audience? Oh, great. All right. Why don't we start right over here?
Amelia, and I just thank you for being here. My question's general, and for anyone who wants to answer it, if there was one book or publication you could recommend that everyone in this room read, what would it be?
Did you say a broader publication, or I didn't?
Book.
Oh, a book or publication?
About housing? About anything.
I'll go. I'll make it really easy for you. You could just watch a movie. It's called 13th. And if you haven't seen it, it could, I won't say it will likely change the way you think about the criminal justice system, who's in it, what we're doing to people, and why it keeps perpetuating.
On housing, I think also Evicted, and it sort of explains easily to people. If that was what you asked, I wasn't quite sure what you asked, but the whole, and it's very easy read, entertaining,
Yeah.
if that's in quotes.
Engaging, maybe.
Engaging, thank you, Diane.
All right, I saw some hands over here. Let's come over here first. We have one right over. Yeah, there's a microphone coming.
Hi, thanks. This is actually for the moderator about a ally that's not here. I organize in San Francisco, and we organize renters, market rate, and anyone, right? And in San Francisco, the affordable housing advocates actively antagonize market rate renters and market rate building, which we were talking about earlier. The first day we had there's this sense that for people who don't use affordable housing, they're like, why does this affect me? And it makes it even worse if you're actively antagonizing them. And so the question is, what's the upside? What's the value of opposing market rate housing, considering that it takes up organizing time and effort? What is it doing for the affordable housing movement to oppose market rate housing?
I'm not sure anybody is opposing market rate housing here. I think that would be an interesting conversation to have. I think there's a question of where is the greatest need for federal resources to solve the affordable housing crisis. And certainly the data and the research show very clearly that the greatest need is among the lowest income people, whether they're severely cost burdened or whether they're experiencing homelessness. And so the conversation that we have is when we're talking about federal resources in order to solve an affordable housing crisis and where they should be directed, I think there's a very clear and easy case to make that scarce resources should go towards those with the greatest need. But certainly market rate housing is necessary for the market. But that's not something we're advocating for because that's happening already because there's a profit to be made there. So market rate units, high-end units, they're going to be built because there's a significant profit to be made. So our focus is not to say not to antagonize or say that that's not necessary, but to say when we're talking about federal solutions and federal subsidies, they should be directed towards those with the greatest needs. So you had a question right here, and then I'll go over to this side. Right here in the pink.
My question is for Harry and one for Margaret. Harry, in Cincinnati, we have a community school, and it's not really working well for our neighborhood because of the way that it's district. There's a school that sits in the middle. There's 649 public housing units at the top. There's 608 at the bottom. The children who live at the bottom have to be bused out of the community to North College Hill to go to school. They have no access to this school. So how do we work on redistricting it so that the children can live there? Because it also causes a divide in the community. Well, you don't go to the same school I go to, and we live up here, and y'all live down there, and we ain't allowed to get along. And so it also, it feeds that separation of community. And for Margaret, just was asked to sit on a family unification in Cincinnati, and I would like to know how that work is going for them.
Great, so Harry, you want to start with the education question? Yeah, it's a big one.
Yeah, it's big. So I think to start, it's actually getting, because my guess is Cincinnati, not having been in Cincinnati, is a lot like a lot of the districts that we work in. So the vast majority of the educators that work in that community don't live there, right? Well, that I can't argue. I don't know, right? And so actually having them participate in it becomes tougher, because that's who you, in a lot of cases, need to help advocate to make those changes, right? It has to happen at this. Part of it is school district policy, right? It's board policy. So chasing down the board, the school board, is really the course of action. But how you get to pressuring the school board to change that is going to, I mean, in theory, it should be enough for the community to put pressure on them. But to have educators standing with you, and in this case, to have housing advocates and educators standing together to talk about the impacts, again, on the young people, right? And I think the way, if the direct communication with I don't know the local union there at all. Like I don't, but my gut tells me, just from my own experience, is that, I'll ask this question. No, it's a good question, because I think there's a lot of value in the learning about what happens in local communities, right? Are you familiar with the school board?
I was on the LSDMC committee, so I'm very familiar.
So in terms of the makeup of the school board, does it mirror the student population in that community? Right. So here's where it becomes, because this is the value in it, is the sort of the direct connection and the pressure and the advocacy at the school board, right? Recognizing who they are going to respond to, and who they believe has power in the community, right? Even though you're there, they actually will respond differently to the educators, right? And I believe, and my experience tells me that the way to push back on the educators who are not participating in the development of these young people is to put it in their face, right? Which is, you say every day that you care about these children, that you love these children, that they're your children. Where are you, right? We need your voice in the room to push back on the school board, right? And the only other thing I would say is, when you say it's a community school, well, that's not a community. Yeah, there's a lot of that going on, where people are saying a school is a community school, but it doesn't rest on the pillars of what a community school is. And this sounds to me like that they're using the title, right, to make a claim for what it is, but clearly it's not serving the community. So one of the things we can do is to get you some information to at least inform folks about what it actually means to be a community school, because in this case, it's clear to me that it isn't if it's not serving the community. And I would guess is that they're split. The other thing to look for is if they're busing kids to schools that have low enrollment so that they can keep them open.
Okay, thank you. And Margaret, on family unification, and then I think I saw George. Did you have a question? We'll go to George next.
So, so the New York City Housing Authority, or NYCHA, the Family Reentry Program that we've been partnering with them on for the past few years, along with the Corporation for Supportive Housing, our state corrections agency, Department of Homeless Services in the city, and about 13 different reentry service organizations. Those are some of the main partners there. So the program is working really well. The way it works is, and I'll keep this really brief because there's a whole report you're welcome to read, but the way it works is the nonprofits are referring people to NYCHA who have family who are already in public housing, and the people they're referring have been out of prison, jail, or a juvenile facility 3 years or less. So they're in that active sort of reentry period. If people are accepted into the program, then they participate in 6 to 12 months of case management with that referring organization. And they're living at home during that time. They're living there under temporary permission. So that means that any income they generate doesn't affect the rent for those first 2 years. And then at the end of the 2 years, if they want to and the family wants to, the head of household can apply to add that person to the lease. So the program's been operating about 3 years now. There have been 2 people who've been reconvicted of a new offense out of 101 people in the program, which by any other measure is a humongous success. We would have hoped there would not be, we'd be 0, but being realistic, that wasn't gonna happen. So it's been terrific. And one thing I'll just put in a brief plug. So at Vera, and this sort of gets to like how do you encourage more local action, we have some funding to provide technical assistance to housing authorities that want to develop a similar kind of program or that want to make broader policy change in thinking about residents who have conviction histories. My little Twitter thing isn't on there, but it's at Vera Institute. So if you wanted to follow us or just check in on our website in the next couple weeks, we'll be releasing that RFP and inviting housing authorities to apply. And so I think that's another opportunity where maybe your local housing authority isn't really thinking about this issue, or they've got other more pressing priorities, but people in the room here and your colleagues in your communities may be able to bring this RFP to the housing authority and say, hey, this is something we should really check out. So that'll be something coming in the next couple weeks.
Great, thank you. So we have time for one last question, and George is gonna ask that one because we have to end right on time to make sure that the staff can come in and turn this room around for dinner. So hopefully panelists can spend a little bit of time maybe afterwards with folks in the hallway, because I know there's a lot of interest. But George, please.
Yes, thank you. Thank you for coming. Appreciate you all very much. But I want to tack the elephant in the room. I have Harry, Nan, the gentleman in the middle, and the lady on the end. All of you represent 4 different silos, okay? In the last 20 years, all of your budgets have been cut. And when you go on the Hill, you advocate for education, homelessness, jail.
Why advocate for
I see.
jail?
I'm just saying, I'm saying for the money to do what it is that you do. So why haven't we gotten together and did the unification instead of the division? In other words, why, when I go on the Hill tomorrow, I'm going to go and arguably ask for programs that the National Low-Income Housing Coalition has put together. But I'm also taking health care because that's my other issue on the table. So we're not just taking our own particular siloed information, but we're also taking the issue of our comrades, our partners. I don't see that. I don't see that. I don't see folks from your organizations at the local levels talking about when a housing authority is doing a plan, a con plan, the city is doing a plan. I don't see none of you at the table arguing and standing up for the residents of those particular communities that are going to be affected. You sign off on the plan, but you're not at the meeting. So while I appreciate everything that you do, I'm sort of distressed and disheartened at the fact I never see your organizations at the local level advocating for the residents in different communities across this country who are doing something and standing up and saying, this plan is wrong. Something's wrong with this plan. I don't see you.
So I think actually, thank you, George. That's actually a perfect last question for everybody's thoughts on, because that's exactly what we're trying to achieve here, right? That's why we have this panel. That's why we've been having these conversations, is to get to exactly that. And I think, and we are making real progress. Like we're seeing, like, you know, the American Academy of Pediatrics that's now saying housing is healthcare. And they're making the case for, and they're prioritizing expanding Section 8 vouchers. And we're seeing the National Education Association, right, saying we're seeing kids churning in and out of our classrooms. We're seeing the impacts on those individual kids, on the entire classroom, on the teachers' hours, and we need to talk about affordable housing. So maybe we can just have a final word from each of you on how we're moving towards this and how we achieve it.
Yeah. Thanks, George. So I would start, he's absolutely right. I would start with NEA is what we refer to lovingly as a loose confederation of independent states. And I think oftentimes folks think of the union in terms of the spirit of collective action and that we always stand together. And so while the national office has made some strides in terms of our legislative program that's inclusive of a lot of what we've talked about here today, and I know you've talked about being at the conference, it is something different. It's altogether different, pushing our states and local affiliates to those same sorts of actions. I'm not into making promises, right? But what I can tell you is that, like I said earlier, that we are seeing locals that are more willing to take up the banner on other issues. But what I don't know is how often folks are reaching out to them and they are simply refusing to do it, to participate, or if they're even being contacted. And my suspicion is that because of our lack of response over the years, that they aren't even being called. And so unless they are aggressively pursuing participation on some of these issues themselves, that they are not being invited necessarily to participate. And that's what I was trying to get at earlier, is like we've got to, I am encouraging folks, the local communities, to sort of let go of what happened a few years ago when they didn't show up when you invited them. But I do believe that a lot of our locals, not all, by no means all, but there are a lot of our locals, particularly in a lot of the larger cities, that see the writing on the wall, which is if we don't get together, right? If we don't get together quick, it isn't just going to be us that loses our bargaining rights this time. It isn't just going to be that. it is, right, communities are going to be devastated if we don't figure out how to get together. So the only thing I could say is reach out to the local union. I would love to tell you that if they don't respond, to call me. You can call me, and I'll call them, but what I cannot do is promise that they will respond accordingly. But sometimes it isn't the local union. It is actually getting to know the educators and the adults in the building as opposed to going to the leadership of the local union, right?
Thank you. And we're going to have to do a bit of a speed round here for final thoughts on this. No, that's okay, but Nan.
Well, you know, certainly the Alliance is very active with housing advocacy at the national level, and it's always on our agenda for what we give to localities. I think sometimes the homeless groups are not active advocates, but I will certainly take your admonition to heart, and we'll see if we can get them more agendaed up. And I think it goes to Rich's point that we all need to be working. I can promise you they're probably not very active on the school issues and some of these. So, and probably neither is the Low Income Housing Coalition membership at the local level, present company excluded. So we all need to work more together on in support of each other's issues.
Thanks, Nan.
And I would add that I think one of the reasons I'm here today is because I think Children's Defense Fund has realized that we've been absent on this area. And the first thing we can do, we have a national standing because we have a national office, and we're actually in 7 states. We're not everywhere, but we're in 7 states as well as doing state advocacy. But we have not been present, I think, as a strong advocate for affordable housing, and we want to change that. So the first step for us is what can we do on the federal level, does that make sense, before we go down to local level. But I do agree with you. There's no thing to say about that. But the only thing I'd add is also, I encourage my friends to show up, because the reality is that I care deeply about children, and I'm going to show up for children across the whole child. But I also care deeply about our environment, and I think we're also at a precipice with our environment, and I cannot go to every environmental meeting. Does that make sense? I just can't. So there's a capacity issue. So I need you to be the environmentalist. I need you to advocate for dogs. I need you to advocate for seniors, and I'll take the child. Does that make sense? We'll all kind of move in the same direction, hopefully. But I think that's probably how social change happens, is we all have to realize capacity issues as well. But yes, we'll try to do better.
I think at the center, what we're focused on is the language barriers. So we're trying to do the translation so that so in the housing space, what that means is our housing team is going to be doing what we always do around housing. And then I'm going to be working with our healthcare team on how to take that and write it for a healthcare audience, or take that and write it for the SNAP team, or the food assistance team. So that's what we're going to be actively really doing, and hoping then that you'll use those tools to engage your health partners, your human services partners, and so on.
I feel like I'm a little bit of an oddball in this one, but I think our main kind of advocacy is really around taking what's best practice and what's research, and making sure that people who are in a position to make policy change are informed by that, and hope that they base their policy on that as much as possible. I will say, on the specific engagements we've had with public housing authorities, the resident leaders and advocacy groups of either formerly incarcerated citizens or public housing residents have been hugely important in shaping those conversations. The policy change, in my opinion, wouldn't have happened in New Orleans but for those 2 advocacy groups that really were relentless in saying, we need access, we need access. And then there was an opening, and so we were able to move forward. And we also have a local office there, and we are not in very many cities in person. And so that was also a big difference in that situation.
Thank you. Thank you all for joining us. Please join me in thanking the panel. Thank you.